Right then, welcome everyone and to the Dundee IJB meeting of the 22nd of October 2025. Councillor Ken Linwood would normally be chairing it today, but he's not very well. So he's going to, he's enabled me to take on the chair role for this meeting, and he'll try and chip in where he can, but he's not feeling that good. So I'm here to keep order, he tells me. So I don't think that should be very difficult. So thank you so much indeed. So Arlene, do you just want to check out the attendance today?
Yep, I will do. Just Chair, before I do that, I'll just remind everybody that the meeting's being recorded and it will be placed on websites for public viewing. So we'll now do the roll call. Councillor Lynn.
Yeah, I'm here, thanks.
Bob Benson.
Here.
Councillor Toland. Councillor McHugh.
Present.
David Cheap.
Present.
Colleen Carrollton. I've had apologies from Glenn Lloyd. Dave Berry.
Present, Arlene.
Christine Jones.
Present.
David Wilson.
Present, thank you.
Jane Smith.
Present.
I've had apologies from Sanjay Pillai. Raymond Marshall.
Present, thanks.
Jim McFarlane.
Morning, Arlene, I'm here.
Christina Cooper.
Present, Arlene.
Martin Sloan.
Present.
And I've had apologies from David Shaw. So that concludes the roll call. Chair, will I just carry on with the agenda?
Yes, please, Arlene.
That's item 1 is apologies which have been noted. Item 2, declaration of interest. Are there any declarations? I'm not seeing any declarations, so that takes us on to item 3A, which is the minute of the meeting held on the 28th of August, which is submitted for approval.
Okay, thank you so much indeed. And could I just take any comments relating to the accuracy of that minute, please? I'm assuming there are no comments being made, so therefore can we just therefore approve the minute of the last meeting, please, of the meeting held on the 20th of August. So that's that's approved. Okay.
Thanks, Chair. That takes us on to item 3B, which is the action tracker, which is submitted for noting.
Okay. And Dave, do you want to speak to this?
So thanks, Chair. I mean, hopefully the kind of the details quite self-explanatory. We've got a few items that are due back in December and kind of later on in the year, and a couple that are kind of should be completed after today's meeting because they're presented today. I did kind of provide members with an overview of item 1 on the agenda in terms of the kind of where we are around the kind of progress, and we'll kind of report back kind of to IJB members very soon on the preferred option and how we'll kind of manage that going forward in terms of the future meetings. And the other one just to highlight in terms of the recruitment to the service user rep for IJB, although it's due in December, just to confirm that.
Oh, hang on just a sec, Dave. With that item 1, so we're trying to have a position resolved before the next meeting on the 12th of December.
Absolutely, yes.
Okay,
we'll be
thank you so
clear
much.
by then. Yeah, sorry for jumping on there. In terms of the recruitment to service user rep to the IJB, in terms of an update, currently assessing the options that have been undertaken by other partnerships and how successful they've been in terms of that. I kind of move away from the traditional recruitment to that service user rep, as well as producing and developing a kind of role descriptor for the role itself. So, but I'll report back to members in December around that.
I was kind of hoping, Dave, that we would have the position resolved before the December meeting, because clearly we won't be in a position to have someone at the 12th of December meeting if the decision won't be made till then. Could we do this as an email update, if possible, if we're able to recruit between now and then?
So
That's quite a long time without. That's a very long time without a user representative.
yeah, no, I absolutely appreciate that. I think kind of looking at the process that other kind of IJBs have done around recruitment, you're kind of looking at a recruitment process that's similar to how you'd recruit a member of staff. Therefore, to have somebody that know an advert, so the role descriptor concluded and agreed, and then go through the recruitment process, I think it's going to be too tight to have somebody in place for that December meeting. However, I do accept the delay in getting somebody onto the board.
It would be quite helpful also, Dave, if we could see this role descriptor when it comes down, so that we can see what it is we're actually recruiting to now. So I'm happy for that to be circulated between now and when that's clarified. That would be quite helpful. Thank you very much indeed. So that's an ongoing matter in progress. And you're now going to go on to item 5, I presume.
No, 4.
That's a complete one. Dave, you're going to talk to that one.
Sorry, so I thought we'd moved on from the action tracker there. So, don't know if there's anything anybody wants to ask in terms of the action tracker itself. Anything else? Dorothy, do you want to come in?
Yeah, just to say, I mean, it'll be interesting to see a role descriptor, I'm sure, for, a service user rep, but we've surely had this before. It's not rocket science. And I just think, Bob's right. We've waited far too long for this. It's really important, especially since we're now approaching budget development sessions, to look at what's going to have to be cut next year. And, anything that can be done to speed this up would be greatly appreciated. It can't be that difficult. And what other areas do? Well, again, it might be interesting, but we've done this before. This is nothing new. We have had a rep before, so surely we can use that expertise and experience to get somebody in place as quickly as possible.
Okay, thank you for that, Dorothy. I think the point's well made. Dave, final comment on this, unless others.
Sorry, just final comment on that, and yeah, absolutely can understand the Councillor McHugh's kind of comments around that. We didn't actually have a role descriptor previously, so that is something that we are developing, and I'm actually taking feedback from our previous kind of public, our kind of service user rep in terms of what worked and what didn't work around the role. So I'm just trying to kind of make sure that we've got everything covered there to make sure this role is a sustainable role going forward. But we'll include all that in the briefing.
Thank you very much, Dave. Do you want to? It would be quite useful. So we've got action point 5. You look to incorporate info into a budget development session, financial monitoring for now included further info on absence levels. Does anyone want to ask any question about that before we move on? Okay. That looking at mental health and wellbeing strategic planning. So this is really critical information, is about what has been achieved and what was still to be achieved, because I do know there's quite a lot of good, positive things that have been achieved, Dave, so we need to make sure that we don't just highlight these within our reports, but we find other ways of highlighting this work as well, in particular, because I know a lot of good work has been done. So that's really important action point. And the last one is number 7. So I have nothing to add to that. Okay, thank you so much indeed. That now takes on to the next agenda item.
Okay, so that takes us on to item 4, NHS membership appointment, and you're asked to note the appointment of Jane Smith.
Duly noted. Thank you.
Chair, Dave's wanting to come in.
Oh, sorry, Dave.
No, thanks, Chair. No, just to welcome Jane and to the IJB, and just also to note, so Jane's on the IJB in her capacity as a registered nurse, but she also has joined my executive management team as the nurse director for Dundee Health and Social Care Partnership. So the kind of the two roles will kind of help complement each other as we move forward and strengthen the sort of the voice of nursing, if you like, across the partnership. So just like to welcome Jane.
And thanks very much, Jane, and welcome to the IJV. Dave, can you just refresh my memory? Who was the previous incumbent in this role?
It was Susie Brown.
Susie Brown.
Yes, thank you. I think we should thank Susie on behalf of the IJV as well, because we didn't have a chance to actually say that to her. So if you could convey that back to her, Jane, thank you very much for her inputs.
I will do. Thank you, Bob.
Okay, thank you. Okay, that's fine. Thank you. Next agenda item.
Okay, that's item 5, Dundee City Council membership appointments. You're asked to note the appointments in relation to the voting members, proxy members and chairperson.
Duly noted. That takes us on to the item. Do you want there are voting members and proxy members and chairpersons. That all covered under the same agenda item. We're not going to go through each one of them. We don't have to. Okay, thank you. Thanks very much. And that now takes us on to the next agenda item.
It's item 6, joint inspection update, and you're asked to note the position.
Want to cover this briefly, Bob?
Yes, please.
It's really just to formally notify and note at the IJB meeting that the ongoing activity around the joint inspection of adult services with a specific focus on mental health, community mental health services delivered from by the partnership. Members have received information and briefings out with the meeting, but it's just really for formal noting today.
Okay, and do you have any idea roughly about the timescale for this inspection?
Yeah, so inspection activity will continue. The kind of field work, if you like, maybe the best way to describe it, concludes just before Christmas, and then the kind of follow-on process in terms of notification of the findings of the inspection and publication of the report will continue into the start of next year and conclude in March next year.
Okay, thank you so much indeed. That's really helpful. That takes us on to the next item.
That's item 7, revised timescales for statutory updating of a Caring Dundee 2 and short break statement, and you're asked to note the position.
That's me again, on kind of Andrew's behalf, as chair of the Carers Partnership. So this is again really just to notify the IJB of a change in the timescale for completion of the ongoing work to revise the carer strategy and the short break statement, and to provide reassurance to the board that there is active work going on in terms of the review of the carer strategy, including the completion of quite a significant amount of engagement work with both unpaid carers themselves and other stakeholders, and there's active work ongoing in terms of drafting the revised content of the strategy, which the Carers Partnership will consider at their next meeting and moving to kind of finalise the revised strategy for submission to the board. Obviously, the agenda note gives a kind of backstop date of the 31st of March 2026, by which the work will definitely be completed, but we absolutely will be pushing to do it before that. And to present the revised strategy to the board as soon as it's available. Obviously, members of the Carer Partnership are very much aware of the need to progress this as quickly as we can, and are continue to be committed to doing that and really active in the process.
Thank you. Are there any questions for Catherine? No, thank you so much indeed, Catherine, for that update. That takes us on to the next agenda, item 8.
The Performance and Audit Committee Chair's Assurance Report, and this is submitted for information and record purposes.
Okay. Ken. Ken, do you want to come in?
Sorry for the delay. I was trying to get the mic on. Thank you, Chair. Yeah, first of all, excellent summary of everything that's been considered by the Performance and Audit Committee this year. There's just a part of it that leaps out at me, and it's the third paragraph. Is it the third paragraph? Yeah, about the latest falls data indicated a deteriorating position in Dundee, etc. And then the final sentence, the falls group are looking into this further. Now, you could go back 10 years, Chair, to 2015, and similar questions would have been asked. Why is our falls position for elderly people so poor? And we would have been told in 2015 by the falls group, or whatever the equivalent of that was at the time, that they were looking into it. And 10 years later, we still don't know. And I don't find that to be satisfactory. So given that the falls group are still looking into it, I was wondering if it could be added to the action tracker. Give them plenty of time, given that it's taken 10 years already. And sorry if that's pretty sarcastic, but if it could go on the action tracker with maybe 9 months from now for some kind of response, even a year would keep me happy, given that it's been 10 years and we don't appear to know what the story is here.
Yeah, I'm considering that. Dave, when is the next report due? Well, maybe I should ring Matthew Kendall in first, but I just wondered, when's the next review update on this for the IJV? And Matthew, you might be able to help us. Matthew.
Thanks, Chair. Yeah, it's a really, really complex sort of situation that we're in, Ken. I think we've done a lot of work, and it's really we're doing work with our colleagues in Scottish Ambulance Service and the Emergency Department, because this is a measure that largely measures the interface that occurs for those services rather than falls per se in Dundee. It's about people being admitted to hospital over the age of 65 as a result of a fall. So we have done a lot of work with the Emergency Department to understand why people go to the emergency department and then what happens with them there. And the conclusions that we've drawn, although we're still looking at day of care audits to confirm this and make sure this is still the case, because you're right, it's been going on for a long time. But we believe that people go to Dundee and they are admitted to an emergency department observation unit where they're cared for and good quality care is provided. And that's as an alternative to returning people home and not admitting them, maybe late at night when they're old and frail and more vulnerable. So we're thinking that this is a measure of high quality, but we've got more clinical work to do looking at patient records to confirm that, because that's not information that we can draw from systems. We're also working with our Scottish Ambulance Service colleagues, because we also know that there are various parts of the system that lead people to need to go to ED, which I'm happy to go into, but won't unless you want me to go into that detail. And we're trying to design systems now whereby our community teams can be linked in much more closely through our Frailty at Home services to be able to respond to people earlier in the pathway, i.e. when they're still at home and they're fallen and they're uninjured, so that our services can support people, can care for them at home, and obviously if they identify that they're broken something, they would call the ambulance back and we would convey them to hospital. but we're doing lots of work to try and sort of change all of that. It is a hugely complex system, but I do feel that we're sort of making headway in terms of understanding why the figures are so poor, and that perhaps they're maybe an indication of how well we're caring for people, rather than that being an increasing problem with more people falling all the time.
And
Yeah, perhaps I'd be happy to just wait for the next report then.
Okay.
Forget
Yeah,
about the
thanks.
action tracker for now. Yeah.
that was one of my assumptions. When is that report due, Dave?
So I was just looking at the last minute of the pack there, because but there's not a kind of time scale in terms of the next a kind of report come back on the fall. So if we can take that as an action for us as an executive team to kind of take away and come back and confirm an appropriate timescale for the work that Matthew's just described, kind of coming back together. So I'm just thinking about from a governance perspective, if you want this to just continue through the Performance and Audit Committee, or whether you want a specific commission from the IJB to the Performance Audit Committee for this piece of work. So
yeah, well, there are two ways of dealing with this. Either we go for out with FAC, a kind of formal report, or given the complexity that Matthew's talking about here, I'm wondering that, irrespective of any of that, whether a development look into this would be really helpful, so that members could contribute a bit more to that. And I wondered what your view on that might be, and the feasibility of that as a timescale. And if we still need a favour after that, then I'm happy to pursue that. But this strikes me there's something much more, a larger dimension to all of this work that's more than just about falls. So I'm just curious about this, and I don't know if anyone else has got another view on this. So I'm wondering, Dave, whether we should look at a development session on this. Dorothy.
I think it would probably be best to wait for the report, because there's work ongoing, as Matthew's already explained, to look into why our numbers are so poor here. And it seems there might be good reason for it. And I think it would be useful just to wait for the report. And if after that we might want to have a further delve into it, we could have a development session. I'd rather we waited for the report that Matthew and his team have been already working on.
Okay, I'm content with that, Dorothy. Dave, do you want to make a final point on this?
yeah, no, just I'm happy with that suggestion. I was just looking at the kind of the next few development sessions are kind of all already allocated anyway, so we'd be into the new year before we would be kind of taking a development session. But we'll kind of take that through as an executive team in terms of kind of a timescale for our report coming back through the park, and we'll can progress from there. Thanks.
And I'd be interested in that report, whether we can make a comparative with other parts of Tayside in terms of what their experiences are. Are they in similar positions? How are they addressing these issues, so that we can see something in the round? Because it's the same medical services that are having to deal with these. So I'd be interested to get that fixture in the round. Okay, thank you so much. So we look forward to report, and you can update us, Dave, when you're going to bring that favour to us. Okay, so that then takes us on to the number 9, Arlene.
That's the proposed revised Performance and Audit Committee terms of reference, and this is for a decision.
Hi there. Yeah, I'll pick this one up. It's good practice basically for the PAC and other committees to be looking at terms of reference on a periodic basis, to ensure that the committee continues to have the remit to operate effectively and fulfil its duties. So the draft appendix that is presented to you just now with the updated terms of reference has already been through PAC at the last meeting, so that the PAC members could review this themselves. And that was approved then from that point of view to come to IJB for formal approval and implementation. I will just say as well that the terms of reference, the previous document was also shared with our internal audit colleagues to have a look at, and there was a suggestion of a couple of additional duties that should be added into it to reflect the introduction of the global internal audit standards that were introduced earlier this year. So the appendix has a couple of highlighted sections which are either sort of the additions or some minor wording amendments to it, just for highlighting the changes, so you can see what the changes and everything are. And IJB is just asked now to review and approve these updated terms of reference for Performance and Audit Committee.
Thank you very much indeed. And certainly looking at 4.1.3, the counter fraud area has quite a focus now, and actually we're moving into International Fraud Week, Fraud Awareness Week, Counter Fraud Awareness Week, and I can't remember, is it 14th of November? It's something like that. So there's a lot of publicity about that already. And I'm pleased to see that there's going to be a formal training program in places for board members, because this is quite an interesting area in terms of what the responsibilities are. Any questions on this, please, before we move to approve? Dorothy.
Could I just ask, under duties, 8.10, Christine, ensure there's direct contact between the PAC and internal audit, and to meet with the chief internal auditor at least once a year without the presence of officers. I'm trying to remember if this has happened previously. I'm not sure whether it has. I really want to just know more about how that will actually work in practice. How will we manage that?
So I'm not aware that the chair of the PAC has previously met directly with the internal auditors on a sort of a programmed or structured basis. But what we have done going forward is we're now, from a work plan point of view, I'm meeting with internal auditors on a regular basis, but we have a bit more structure, and Bob as chair is invited along to our next meeting, which I think is either late November, early December, which will be after the next PAC, but you know, in terms of the planning. And then I shall leave it for Bob and internal auditors to arrange a separate meeting as when, you know, through the year for that separate meeting as well to be happening. But we will look at that one. So there will be meetings with officers and chair and internal audit, but then we can arrange this organise a separate meeting as well.
So the separate meeting will be with the PAC, the committee.
Sorry, and the PAC part of it, yeah, we've that's a new one as well that's been implemented. So we'll have to work out how we structure that particular aspect as well. That has not been implemented or not been done to date. That's a new duty that's in here. But we'll have that conversation perhaps at our planning meeting can't remember if it's late November, early December, and work out how we implement that going forward as well.
Okay, thanks, Christine.
And thanks for raising that point, Dorothy, actually, because in my experience, it's quite an informal process, in fact, and it's really just an opportunity to engage with internal auditors and to pick up on points that I think is quite helpful for working our way through the kind of programs of work that we do and the kind of issues that come up that aren't easily reportable in papers. So it's quite helpful to do that. So thank you for that. That's really helpful. So therefore, this is a report for decision. Are we content to approve this report? Okay, thank you. That takes us on to the next item.
That's item 10, Dundee Integration Joint Board Property Strategy Update, and this is for noting.
Chair, I'll come in and cover this one. So it is, as I said, an update in terms of the progress around the IJB's property strategy. Just a reminder to IJB members that that property itself is not delegated to the IJB. It remains a function of both the local authority and health board. So in effect, what we do from an IJB perspective is influence the kind of decisions made by the partner bodies on the use of assets, and we work closely with both within the Health and Social Care Partnership. We work closely with the kind of the property services of both kind of bodies to make sure that we get the most efficient use and effective use of the assets within the city for our services to be delivered. So the report provides that kind of overview of some of the kind of most recent activity around the buildings that we utilise, and the plans that we've got to kind of move forward to create our kind of our new models of care within different buildings. There is a kind of bit of a description in there at 4.3 around, from an NHS Scotland's perspective, the whole system infrastructure kind of planning side of things, and how that works at the moment is more on a kind of repairs and maintenance kind of cycle just now, but we'll move on to kind of further investment. And from our perspective in Dundee, we need to kind of make sure that we're lined up to kind of make any bids in for future funding to develop the assets that will help our communities within Dundee, and we're kind of lined up to do that. So there's a bit of an update there. I'm happy to take any questions if anybody has any.
Dorothy.
Thank you, and thank you, Dave. My attention was drawn to 4.5, the last paragraph, where it says that funding which was available couldn't be utilised to complete the waiting area at Broughty Ferry Health Centre, since the NHS Tayside Property Service did not have capacity to undertake the work. Now that's a shame that money's been lost and not used. Could the work not have been subcontracted if internally they couldn't complete it? Dave?
No, thanks for the question, Dalton. Yeah, frustrating that we didn't manage to get that through. The issue is, I think, is what I understand, is more around not about the direct provision of the work, but about how that's managed in terms of architects and the sort of planning of that activity, rather than the actual delivery itself. But it is something that we remains live with us in terms of our engagement with both the estates services within council and NHS around identifying where there are opportunities, and trying to encourage that focus on having the professionals wrapped around that for us.
I think some members have some difficulty. Martin's having some difficulties coming in. I just seen something flash up. I don't know whether Elon Toland has been able to come up as well. Okay, I'm just noting that. Okay, are there any further questions on this report? Thanks, Dave. This is a really helpful report. Okay, thank you. Right, okay, this report is for noting, as duly noted. That takes on to the next item.
Thanks, Chair. That's item 11, which is the Information Governance Information Sharing Agreement between NHS Tayside and Dundee City Council for Dundee Health and Social Care Partnership, and it's for noting.
Questions, please.
Oh, that's...
All right, thank you. Who's speaking to this?
I can speak to this, Catherine.
Okay.
Great. So there has been a long-standing information sharing agreement between NHS Tayside and Dundee City Council, and a lot of work was done with a group of the information governance groups in NHS Tayside and Perth and Kinross and Angus. This was signed off by Vicky Irons back in 2021, and we have since had an updated version back from NHS Tayside with Dave's new details and other new people as well. So that will be being progressed to be signed off.
Thank you, Claire. Any questions for Claire on this? Okay, that report is for noting. Thank you very much indeed, Claire. Thank you. Next item, please.
Okay, that takes us on to item 12, financial monitoring position as at August 2025, and it's for noting.
Okay, Christine.
Yeah. Okay, so this is our second financial monitoring report for 25-26, based on the information up to the end of August. As you'll see in the report, it is indicating that our position has deteriorated slightly from the previous report, and we're now projecting an overspend of 5.996 million for this financial year. The underlying demands and ongoing demands, including the demographic pressures, the complexity of need of the population of Dundee that requiring health and social care support and services from the partnership, continue to be this key driver of our projected overspend. The key variances remain in terms of visibility, in terms of our older people care at home packages, but we've also got pressures in housing adaptation spend, community nursing, adult placements and packages. The key points and the variances are detailed through 4.3 in terms of some of the analysis and the underlying reasons for it. But in addition to the demand and the activity driven pressures, we've also got an element of overspend from unachieved savings from this financial year. Members will remember that we have had budget savings of about 17.5 million that we were required to be achieving to deliver a balanced budget. There are aspects of this that have proved more challenging than we would have hoped. We continue to work with the relevant services to try to deliver on these, but some of this is not looking like it'll be delivered in full in this year. So that's also an underlying reason for some of our overspend. However, we also shouldn't forget the fact that the actual level of achievements of what has been achieved actually, and what is expected to be delivered this year has been a very challenging year. And our staff and our teams are working really hard to actually try to deliver everything that we're needing to deliver and manage the financial resources appropriately as best as possible. A couple of additional appendices that have been added into the report now. Appendix 4 gives some additional information in terms of the savings performance and where we are, what we're actually anticipating achieving against the various targets. And Appendix 5 is a new one, which provides some additional information on monthly supplementary staffing spend and sickness absence across both our health teams and our council teams. So from that perspective, we can see that supplementary staff spend is reducing gradually over time, and also our sickness absence is starting to improve as well. So the IJB is asked to note this latest financial position and the ongoing work across the services to address the overspend. But we are obviously remaining in financial recovery, and there's a paper later in terms of some of the financial recovery actions to support some of this as well.
Thanks very much indeed. Thank you, Christine. Ken first and then Dorothy.
Thank you, Chair. Thanks for that. Read the report, Christine. It's unfortunate that we haven't been able to make the savings that we reluctantly agreed to make in terms of care home, home care, sorry, provision of home care. I think we went down from 26,000 and budgeted for 22,000. We're back up to probably about 24,000.
24, yeah.
So that's well short of what we had budgeted for. However, having said that, I keep a close eye, as do most of us, I think, on the RAG status that we get every Friday, which indicates the delayed discharge statistics. And although we were in amber a couple of times over the summer, which would be because of what's said in the report about we were reduced down to whatever the lower figure was in the report. Since we've relaxed the criteria, we've gone back to green. As of the most recent RAG status last Friday, we're back to green. And this is so unfortunate because it seems to me that the sweet spot was what we were spending last year, when I think we were in green RAG status practically the entire year. And with what are relatively small reductions over the summer, we've been wobbling. People are staying in hospital longer, and the whole system's affected by that. And it probably ends up costing more. So just that observation, really.
Yeah, you're absolutely right. We are trying to manage our spend in our care home packages in the best way as possible without destabilising the whole system. And the balance that we're at just now is probably the balance that we need to be to maintain that capacity and flow. And remembering that, we've obviously got elderly, vulnerable people and their families that are directly impacted by this. So, it's not just the financial impact, it's the personal impact of this. So it's trying to do this in a proactive, structured, controlled manner. And there's a number of actions that are continuing to be taken to try to manage that demand through sort of technologies and through assessment, and adaptations and other sort of added alternatives, so people are still able to access some kind of support and care, but perhaps not, maybe not needing the 2-to-1 visits, or the double up visits, or other things that are that financial impact onto this particular budget. But it's a real challenge to try to keep that whole system working smoothly, and again, conscious that we've got a significant overspend that we have to be looking at somehow managing down, but we're also conscious that we're just about to come into winter period as well, and maintaining that capacity and flow through Nine Wells and RVH and other sort of community hospitals without putting particular pressure onto certain aspects of the system.
You don't need any follow-up on that, Ken. Okay, thank you. Dorothy, then David Cheap.
I think David had his hand up before me, actually.
It's okay, Dorothy, and just crack on.
Okay, well, I had quite a lot of queries on this, but I think I'll keep them for the budget development sessions where we can hash out some of this detail. But one thing I wanted to raise was staffing. I looked at the vacancy or absence levels of 6.8 for NHS during the 5 months, this 5 months, and 9.3 for Dundee City Council, and alongside that, at 4.3.10, it talks about the staffing vacancies and the tensions between patient demand and management of clinical risk, and the financial constraints, meaning that we're only recruiting to critical post. I mean, I don't see any way out of this. This is seriously worrying about how we ensure a quality of care. What we seem to be doing here is firefighting. I'm glad we'll be having some further information about absence levels, but in this atmosphere, I can imagine that the pressures on staff must be immense, and I think we really need to be looking carefully at what's happening here. I'm seriously concerned about this tension between only recruiting to critical posts and quality of care that's being given to people who desperately need it.
Dave, do you want to come and address that question before I bring in probably Jim and then David? I think Jim probably wants to respond to that as well, because there are different. The other thing about this is that NHS and local authority different ways of recording vacancies.
Yes, no, thanks for that, Chair. So I absolutely kind of shared Councillor McHugh's concerns around this, because it is a kind of real tension in our system, that sort of balancing off in terms of finance and service. I think from how we can approach this. So for direct care services, there is absolute priority in filling posts. So we are not holding posts back for things like direct kind of social care provision, for services that have to have kind of minimum staffing standards anyway within their services. So whether it's around care homes or particular kind of ward based services, they've all got the required kind of cover that's to provide that quality of care. But absolutely acknowledge that then puts pressure on other areas of services that are not that kind of absolute direct patient and service user facing. And how we kind of manage that. However, there are a number of kind of health and wellbeing strategies that both of our employer organisations have in place to kind of help support staff to kind of to remain in work and to encourage people back to work as well when we look at the staff absence figures too. So absolutely right to kind of flag it up as a real pressure, not just within the Dundee system, but around the whole of the country, around health and social care services. But we are kind of looking to see what else we can do around well-being of health and social care partnership staff.
And before I move on here, David, is your point going to be quite separate from the one we're under discussion? Because I can see that Jim and Raymond want to come in on this particular item.
I'd happily listen to Jim and Raymond before I bring anything else in. Yep.
Okay, thank you for that. Jim then, and then Raymond.
Thanks, Chair. And thanks to Christine. I mean, I think the points that Dorothy made are really, pertinent in the sense of, I get where, Christine said it's a challenging year, but, this is a cumulative thing. This has been going on for years. And that's really what's contributed to the whole, ongoing sort of crisis that there is there. So when we talk about absence levels and stuff like that, and we've been involved in some of the discussions, certainly the local authority around, trying to address that. And there's been some great work done on that about kind of promoting well-being and stuff like that. But there's also an underlying recruitment and retention crisis across social care. And I know that's not just unique to Dundee, that's right across, the board in that sense. But that then contributes to, the highest levels of why people are off sick, certainly for the local authority we get, are to do with, anxiety, stress, depression and stuff like that. And of course, people feeling short-staffed, under-resourced and stuff like that, and I would argue underpaid, on a long term, all kind of, brings that into the mix. And it is really hard to see, being able to turn that around much more than we were already at, in the sense of how stressed and how particularly the workforce feel, and then that knock-on effect in the sense that it has on the services that they're delivering and the quality of the services that they're delivering to vulnerable people that are needed. So I think as an IJB, obviously we need to be kind of aware of that, but I also do think there's only so much that we can do with the ever decreasing budget that we've got, and really in a lot of ways it's just feeling like a managed decline unless we get a really substantial turnaround in political priorities from governments, both Holyrood and at Westminster in that sense. It's really hard. I mean, a number of us have kind of worked in the local authority or wherever you are now for a number of years, and we're seeing it. I'm seeing it both within the local authority setting, but also the third sector providers as well, who are facing, in some ways, even harder challenge in recruitment and retention and stuff like that again. So, sorry, I know the bringer of doom, but you know what I mean? I feel like kind of the really important points. Otherwise, we're just talking about stuff and we're in some ways quite powerless at the moment, or feel quite powerless to really address the underlying issue here.
Raymond. Thanks, Joe.
Yes, thanks, Chair. I think my question and sort of observation as well is that I get a bit concerned that we keep referencing an overspending staffing and it's directly related to sickness absence, because I think it's not as straightforward as that, and I think it's more complex. And I think my question to Dave and Christine is to have we done an analysis against an understanding of the offsetting that we have regarding the vacancy gap that you're holding versus the spend against supplementary staffing? Because I think there could be a position that if we fill the posts, we will reduce the supplementary spending, because we'll actually be spending the budget that we have. Now, that's difficult as well if we've got difficulty recruiting. That's a different element to this. But I still think that if we fill the posts, then we're supplementary spending will reduce, and then we'll be better to identify what the impact of sickness absence is on that. And as Jim said, there's a lot of good work there about supporting staff around sickness absence and getting them back to work quicker. Thanks, Chair.
Okay, Dave, are you going to respond to that before I bring in David?
Yes, no, thanks, and thanks, Chairman. So, yeah, absolutely, we absolutely kind of recognise that there's a kind of false economy of not kind of filling posts, but then having to pay extra to fill posts, whether they be by kind of bank or agency in particular. So, in terms of our prioritisation for filling, so going back to what I said previously around posts that need to be absolutely covered, it's one of the kind of high priorities that we look at. So, if a post requires a kind of a level of cover in which will kind of cost us money anyway, then we will go ahead and kind of recruit to the post. So I mean, unless Christine has corrects me, I don't think we've done a direct correlation between vacancies, recruitment and kind of supplementary spend, but I mean, it is something we can look at but certainly just to kind of give the assurance that that's how we prioritise filling vacancies on that basis. So, Chris, you want to just come in on that?
Yeah, you're
Christine.
right. We've not done a direct correlation between these, but we can see which areas are the bigger spenders in terms of either sickness absence or bringing in supplementary staffing. And the vast majority of these are the residential or ward-based services who need to maintain the safe staffing levels and therefore need to bring in the supplementary. But these are areas that we would not delay a recruitment programme or recruitment requests either. So every attempt continues to be made to recruit to these vacant posts in these high pressure areas and high priority areas. And I think probably the challenge remains then it's recruitment and retention challenges, them actually trying to find the appropriately qualified, trained, experienced staff to fill the vacancies, or the fact that they are high pressure areas and with a workforce that may be off for sort of anxiety or stress related issues as well, because of the complexity of service users that they're needing to be looking after. And I'm generalising now in terms of some of that, but that will be some of the underlying reasons. We will continue to be trying to support that through approving recruitment requests as and when they come up, as best as possible. Sorry, David, but I see Angie's popped her hand up as well, and I suspect that she may come in with something to support this as well.
Angie, is this specific to the point that is okay?
Yeah, thanks, Chair. I'll be very brief. I can only talk to the three areas that I oversee. Two areas that have a significant overspend in terms of supplementary staffing is a combination of absences and long-term underfunding
given the amount of pressures that have come from care home closures, bed closures in hospital, etc., and no additional funding to support that. One area is specifically around absences, where there's been a really unfortunate set of circumstances for a number of staff, which has caused pressures on the service, which then adds pressure to other staff and escalates the absences. But that is reversing now, and we hope to see that settle very quickly. We're not quite back at pre-pandemic levels of absence, but we're almost there.
Okay, thank you for that. Dave, it sounds as though we need to look at the staffing issues and the range of issues that have been raised within this discussion in a kind of separate paper, which is separate for financial performance. So maybe just reflect on that at the moment, but I'm going to bring in David Chief.
Yeah, thanks. Morning, everyone. Just listening to all of that on this, I had 2 or 3 questions on the paper, but just listening to everybody over the years prior to where we are now, when there was more money in the system, I think we've got to still recognise that our absence levels were at the level we're at now or worse. So when there's more money in the system, we still had bad absence rates. It's endemic in the system, it seems to me. So this isn't anything new. But to bring my questions in, Christine, I've got 2 or 3, and so just so I can pull them all together, maybe just to answer them. On 4.3.8, we talk about an overspend of £2 million in other support and centralised management budgets. Now, bearing in mind we're talking about 5.996 overspend, £2 million just in a couple of lines there is kind of. I'd like to get a bit more information on that, because we're talking about £2 million through vacancies. I don't really understand the explanation given just in that sentence that's been provided there. That's my first point. The second one I had was on 4.4.1. I guess you've probably answered it already, even, and I think you talk about the overspend out of our service due to workforce challenges. I'm guessing that's mainly absence and things again there. And my last point was in the table shown in 4.6.1, showing all the reserves by reserve purpose there. It's a pretty simplistic question for me, but can we break down any of our overspend? So if any of it is due to any of the specific headings in this table, that we can utilise part of the £11 million committed reserves specifically to those overspend areas. If, for example, we got in primary care, we got a reserve of 1.933 million. Are we going to use some of that reserves for overspend in primary care? That's what I'm really talking about. So I'll just leave it. I don't want to take up people's time more than that, but these are my 3 points I wanted to really bring up.
Okay, thank you. So 4.3.8, can I take that one off the table and come back to you with the detail of what's in behind that number? Is that okay?
Absolutely fine. Yeah, thank you. Yeah.
4.4.1 in terms of the out of hours position. So you may be aware that there is a wider out of hours reform programme ongoing across Tayside, and we've actually got I think we've got a report coming to the IJB in December, but there's a briefing session for IJB members across Tayside on Friday. So yes, the challenge for GP out of hours is thanks Dorothy, I'll get that. I'll send it to all. So the GP out of hours position is workforce, but it's demand and capacity across Tayside, and making sure that the right service, the right support are there for that. Yes, there has been an increase in demand, and like everywhere, the funding to manage this has not been able to keep pace with it. So they're looking at wider reform in terms of actually how to deliver the service in a way that's appropriate for the demand, for the skill mix that they have, and the financial constraints as well. But we have a development session on this one.
Christine, is absence affecting that as well?
I don't know if absence specifically is affecting the GP out of our service in any greater way than anywhere else. I'm not entirely sure, to be perfectly honest. And 4.6.1 in terms of reserves. Yes, we have done a review of our reserves, and in the financial recovery paper that's later in the agenda, some of these reserves are planned to be utilised for, or we're going to ask the IJB basically to release some of these reserves, these committed and earmarked reserves, for supporting the overall position. We do continue to look at every earmarked and ring-fenced reserve balance that we have. However, some of these are very clearly from allocated for very specific purposes, and we would need, if we were to change some of this, we will need to go to Scottish Government to ask for permission to release some of the balances that we have if we're not going to use it for the identified allocation purpose or the grant purpose that we've received it for. But there's some of them that we do have some flexibility, and we'll pick up on some of this later in the agenda, the paper.
Sorry about that one, Chrissy. I just realised I typed the question into my paper, the text part of the paper, and then before I'd read the mitigation paper on the overspend. So I appreciate you did actually say that some of the reserves are being used there. So apologies for that. Yeah, I get that now. Thank you.
No, that's okay, David, because it's a fair point you make anyway. Are there further questions on this one? Dave, there's quite a lot about workforce sustainability here. And can you refresh my memory on when we will have a further favour just on the workforce sustainability issue, because of the service demand and the financial pressures that go with it? Do we have a timescale on that?
So I can't remember off the top of my head in terms of our workforce planning paper that will kind of help kind of influence a lot of this, because that kind of sets out quite a range of actions that we're taking around sustainability and support to the workforce. So if I can come back to you, if Arlene can note that as an action point on the action tracker, we'll come back, and if there's not one due within the next quarter, then we'll take that as an action as an executive team to pull something together separately.
Yeah, thanks very much for that, Dave. And of course, that will also be influenced by the Tayside-wide delegated services review that you're doing as well. So that will impact on that favour too in 4.4.1. Thank you. Dorothy.
I just want to ask, when we do get some further analysis of absence levels or absence information, I think you already highlighted, Bob, that information is collected in different ways between NHS Tayside and Dundee City Council. So I think it's important, if it's possible, that we're able to look at like for like, you know. I don't know how much work would be involved in something like that, but as closely as possible, it's important that we are comparing like with like, because I cannot just make that ask. Sorry if I'm giving work to somebody.
It's okay, Dorothy. Many have tried on this issue. This is not a new one. Thank you. And Dave, rather than go into answering this, I think Dorothy's made the point, and I think what we're trying to do is trying to get some kind of real comparator. Okay. I'm going to wrap this up, and thank you very much for this this financial monitoring paper. So I think that there are a number of issues there for noting in the recommendations. So we note these, which then takes us to the next paper, please, Arlene.
Yep, that's item 13, which is Dundee IJB 26-27 budget outlook, and this is also for noting.
Okay, this is a first look at our budget position for 26-27. I know that we've got a development session planned for next week to start looking at some of the more in-depth detail and sort of the plan. But this is a sort of first initial look, a very high level. with a number of assumptions in terms of the potential cost pressures and the projected gap that we have for 26-27. That the work will obviously be continuing over the coming months to refine these figures, particularly once the UK and the Scottish Government budget settlements are announced. And then those information filter through NHS Scotland, NHS Tayside and to us from that side, and through the local authorities to Dundee City Council, and then they do their budget setting. It is worthwhile pointing out that the UK Government budget autumn statement has been pushed back around about a month from our sort of previous understanding and expectations. So this autumn statement will not be released until the end of November. The Scottish Government's budget is pushed back about a month as well, so that's early January. So obviously that all means that we locally will have a much tighter timescale in terms of understanding and refining these the assumptions with sort of known information, because we still need to be setting our budget before the end of March. The figures that are detailed at this stage include or incorporate the current overspend drivers, as well as recognising further growth demand, inflationary cost pressures, including the pay award for our council and NHS employed staff. We are in the fortunate position at this stage in comparison to previous years in that both sides, for Agenda for Change and local authorities, did agree a 2-year pay award. So we know what the 26-27 pay award implications are expected to be. It also includes some, again, assumptions about potential additional funding that we are expecting that will come through to offset some of that, the cost pressures, in particular the uplift assumptions through the NHS side, and assumptions from Scottish Government in terms of an assumed Agenda for Change, assumed adult social care pay. So the cost and the funding is currently built into that, but again we still await national announcements regarding what may or may not change in terms of a national position for social care, for adult social care payment. The scale of the gap for 26-27 will obviously present us with a further really significant challenge, with savings of around about £13.6 million currently projected for next year. And as we've already highlighted, it's almost certain that we will have no reserves in our balance sheet to support this position. So while we had a £17.5 million challenge last year, we had some reserves that we could reduce that down by. It's likely that that's the 13.6 will be with no reserves to offset this. Table 1 details that sort of funding gap, that 13.6 million, which comprises of additional pay and inflationary uplifts around about £8 million, provision for demographic and demand growth of about 6.7, recognition of the 25-26 costs that we managed this year through non-recurring savings and one-off funding, which was 5.8, less anticipated additional funding of 6.9 million. So that net position is 13.6. As senior and extended management of the health and social care, we are asking teams to be looking at local developing local service plans to consider the options for individual service areas and the opportunities and implications of this to help manage the financial gap. And we will be reviewing these returns internally and presenting these to IJB members as appropriate as the process progresses. And as part of this, as we've already highlighted and already discussed, we'll obviously be looking at the whole system impact of the proposals that are coming forward, the risk implications of this, and making sure we're mitigating against potential harm, and we're managing the impact on service users and patients as well as other parts of the care system. And absolutely considering their overarching strategic priorities of the IJB as well. We obviously can't forget the ethos that for the whole purpose of the IJB being set up in these strategic priorities. A provisional timetable of the sort of planned activity is detailed in Appendix 1. It's detailing some of the work that will be going on in the background, some of the information that is happening through partner bodies or at national positions in terms of dates, and also highlighting how and when the information will be expected to be presented to the IJB as we go through the next few months. And it also remains our intention to be identifying the budget savings proposals for a consultation period that we're anticipating will be sort of through January, February time, to then pull that analysis together, presenting it to yourselves and to allow you to make informed decisions at the budget setting meeting in March, where we're aiming obviously to be setting a balanced budget for 26-27. So at this stage, the IJB is asked to note the expected budget position and gap for next year, and the process and the timetable that we'll be working to towards the end of March.
Thank you very much. Before I invite questions, Christine, we have a budget development session around this very area on the 29th of October.
Yeah,
will that
next
will there be further information that would be useful for us? Because this is quite a full report.
I'm hoping that we'll be able to get something, and at the very least having that some of that conversation as well about some of the things. Okay. We have asked all our service managers to consider what they can locally do within there, and we will try to be pulling some of that information together. And then having that sort of discussion around different options and opportunities.
Thanks very much indeed. Dave, and then Dorothy.
Yeah, so just to add to that, so in terms of that kind of session next week, that'll also include a better understanding of the figures that kind of Christine's presented in terms of the various cost pressures, because I think we've done that in previous years. I think it's been helpful for members to kind of understand what's coming through and why. So there'll be kind of some kind of reflections on that, and I think given the stage that we're at, as Christine says, with getting feedback from managers around the what might we kind of look at would be kind of pretty sort of high level sort of themes rather than anything service specific at this stage. But we'll have obviously development sessions all the way through up till when we set the budget for that kind of bit more detailed conversation. Thanks.
Okay, Dorothy.
Thanks, Christine, for the heads up. I don't have much to say on this except I'm in despair. But we'll keep that for the budget development sessions. One question, if I may, and it's maybe a naive question, but at 4.6.1, it says funding for demographic pressures is not provided by either of the partner bodies. So we have to find it within our delegated budget. I really want to ask why not. I'm reluctant to ask for more funding from already stretched partner bodies, but could someone answer me why demographic pressures, which are a fact of life, we can't go to the partner bodies to ask for extra funding on this?
I can see that the days kind of come in as well, but yeah, so the partner bodies have passed over additional funding as required through wider national legislation. They have not passed over anything in addition. So we've always received uplifts in line with sort of national position, but we've not received anything in recent years. In fact, probably for more than recent years, anything in addition to sort of the sort of national legislation or statute type of aspects. I would also say though that we've not been hit by additional savings either, which some with other say council departments or NHS departments would have been taking budgets off. So we have had our core budget plus sort of national share or a local share of national pay uplift or the funding that their partner bodies have received. Dave, did you want to add to that?
Yeah, no,
Dave.
thanks, Christine. So yeah, so as Christine says, so the parties, the statutory partners aren't kind of instructed to pass on additional funding for demographic. They're only instructed to pass on the funding that flows from Scottish Government for things, specific things, including kind of pay and adult social care. Pay uplift when it comes. That's not to say that we can't and we will continue to kind of lobby with our partner bodies to receive additional funding in recognition of those demographic pressures. So that is still something that does happen, and we will continue to make the case for that. As we've described on numerous occasions, the impact on the whole system, and that, in terms of particularly the acute sector of not investing within kind of community-based health and social care services. We know what that impact is, and therefore it's in the kind of interests of our statutory parties to make sure that we do have sustainable funding levels going forward and sustainable services going forward. So just to kind of let you know, that's not just because they're not told they have to do that. It's not to say that there's not work kind of goes on to kind of push for that as well.
Thanks, Dave, and I'm sure we'll revisit this discussion at the development session as well. Thank you. Christina.
Thank you, Chair. It's probably a question for Dave, and I don't want to preempt, any potential challenges across all services, but it certainly will impact on the third sector and the third sector services that have been delivered. And you did say there will be local plans coming forward, they'll be a bit higher level, but if it's going to impact on the sector, when will we be consulted in this timeline? And I know that's quite difficult due to the timelines from the government budget and the local budget, etc. But it's vital that we are involved as soon as possible so we could start planning ahead. We've got people, jobs and services to consider that we're finding it difficult to sustain at present.
Yes, thanks for that, Christina. And absolutely, I mean, the plan is that we would have early engagement with our third sector providers. As Christina said, this is still an emerging kind of position anyway, so we need to kind of understand impact and what options are kind of being put forward in terms of a kind of set a potential package of savings. But we'd kind of made that the commitment that we would engage with the kind of third and voluntary sector and independent sector based on kind of last year's experience in terms of where we were. So we will kind of get dates and times in the diary over the coming months to have that engagement and regular engagement, not just a one-off with providers. Thanks.
Thanks very much indeed, Christina, and that your question is well made. Actually, it's a concern for us all. Actually, thank you. Okay, no further questions. So we note the recommendations within this report, and we'll now move on to the next item. Arlene.
Okay, that takes us on to item 14, Financial Recovery Plan 25-26, and this is for a decision.
Thank you. Back to me again. So obviously, as we've already highlighted through financial monitoring, we do have an unplanned projected overspend for 25-26, and as required through the IJB scheme of integration, we are required to develop and approve and implement a financial recovery plan, and also share this with our partner bodies as well. So this, the plan that's presented, the report that's presented in front of you just now takes into account the sort of the current pressures, the current position that we are in, and actions and mitigations and opportunities that we have within our current financial position, to try to resolve this. So first of all, as I was saying, we have a projected overspend of 5.996 million, and we currently have a general reserves balance of 644,000. So the assumption is that assuming that our operational activities are unable to resolve our financial position, then that general reserve will be utilised to offset some of the position. In section 4.2.2, this highlights the actions that that we had actually implemented in the financial recovery plan from 24-25, and highlighting and requesting that these actions are continued to be implemented with some enhancements in terms of the controls there. I will say though that what we started doing in 24-25, much of that ethos has actually continued in the background anyway as we've moved into 25-26. So much of this in terms of our recruitment controls and monitoring supplementary spend and discretionary spend and these types of things, we have continued that. But this is just documenting to say that this is part of our financial recovery plan for this year and this ongoing. 4.2.4 requests and highlights some additional and enhanced actions that we are also now looking to be implementing in terms of a slightly more structured or tiered approach to some recruitment. And while we are only approving recruitment requests that are critical for critical service areas, we are now trying to take that slightly more tiered approach and looking at some of them that we may be able to implement a short pause of around about a month is what we're looking at, where we can actually sort of slow down and create a little bit of additional slippage or vacancy within the services. These opportunities potentially are sort of few and far between, as the only recruitment requests that come to us are for critical posts anyway, and these are the only ones that we'll be looking at. But it's just adding to, you know, just something else that we were able to be looking at, and some aspects of Tayside-wide collaboration with our Tayside-wide services in terms of the lead partners in general medical services and the prescribing, and looking at opportunities for collaboration with our two enabling health and social care partnerships, but also our partner bodies in terms of Dundee City Council and NHS Tayside for other whole system prioritisation and working there. As I mentioned earlier, and David rightly raised, we have looked at our reserves balances, and in terms of where we've got that sort of flexibility that we no longer need to continue to hold, that they're no longer legally committed or statutory committed, that we need to hold these balances for particular purposes. From that review, we are asking the IJB to approve a decommitment of around about £500,000 from our earmarked and ring fenced. This is detailed in 4.3.5 there, and it's asking IJB to release that 500,000 from that to align to the overspend this year. We have had conversations with the relevant leads for these balances and confirmed that there's no planned commitments against these balances, and there'll be no immediate or short-term detrimental impact. Obviously, there could be a sort of a longer-term opportunity lost by using these balances just now, but we're at the stage with financial recovery that we don't have the luxury to continue to hold balances for a future use. Well, we have this current financial position that we're looking at. The section 4.3.6 is actually also asking the IJB to release or approve utilisation of an earmarked reserve that we set aside back in 22-23, which was £500,000 for infrastructure support. We're actually asking the IJB to release this so we can actually create some spend to save opportunities within for sort of longer term benefits, and create the working environment for further efficiencies and transformation. At this stage, we don't have the final costings of this. The IJB has been asked to approve this in principle, with the specific costings to come back at a future date. But the money is planned to be utilised to allow the purchase of mobile and agile devices to allow some community-based teams and staff to work in a more agile way and create some efficiencies and capacity there, to purchase various IT licenses for specific staff and teams, to again enhance some agile working and increase data analysis and AI capacities and capabilities within our services, and also to support some project work to progress some of the savings proposals that we've not been able to fully release at this stage, just due to our own capacity across the service. So that's detailed in 4.3.6. The estimated financial impact of what I've been able to quantify at this stage is detailed in Appendix 1 for the various different actions. You'll note that there are some that are still marked as to be confirmed, and work is ongoing to further develop these proposed actions and quantify that financial impact. Appendix 2, gone to the wrong place. Let's check that one. Nope, sorry. So yeah, so the implications and actions of we've had discussions with senior managers and financial colleagues in both NHS Tayside, Dundee City Council over the last month or two. And the report will be requested, be taken to both the council and NHS Tayside at a future date. I think we've got a date for Dundee City Council. I've not got a week date yet for NHS Tayside's board, if that's needed to go, or what that structure is going to be. So the IJB is asked to note and approve the financial recovery plan actions, including the decommitment of the ring-fence reserves and the proposed use of the infrastructure reserve, as well as instructing the plan to be submitted to partner bodies and instructing a further update at the December meeting.
Okay, thank you, Christine. Ken, and then David Chief, and then Dorothy.
Yeah, thanks very much. And with relation to 4.3.5, I don't want to see any cut to the drug and alcohol balance. Just yesterday, I registered for the Drugs Death Conference in the Baptist Church, I believe on December the 10th, a 3-hour event, because the rate of drug deaths in Dundee continues not to be just astronomically high in Scotland, but in Britain, in Europe, and in the world. And I think it sends out entirely the wrong message to take anything out of drug and alcohol, the drug and alcohol balance. I've been on first name terms with dozens of people over the years, literally dozens. I don't know if anyone remembers seeing it's a video that went viral. I can't remember who. It was an MP, the very posh MP, the Tory MP from the West Country. I don't know if anyone ever saw it. And interviewing two people in the City Square around about the time of the independence referendum, and everyone was laughing at them because they had strong Dundee accents. They didn't really understand the issue. And someone reposted it again recently on Facebook, and I was asking them, what about so-and-so, and what about the other guy? Dead. Oh, what about his brother? Dead. The death toll is staggering, and I am not prepared to approve any reduction in the drug and alcohol balance for the reasons that I'm stated. I'm sorry for that, but I'm just not. I'd prepare to go to a vote on that. Thanks.
Thanks, Ken. That's fairly clear. David. You're on mute, David.
Apologies. Sorry, Christine, just two questions. 4.3.6 on the possible, to take out 500,000 for the infrastructure support. Just one part, I get all the equipment bits. When you talk about a recruitment of a 12-month project business manager, of that 500,000, what would be the sort of cost of that? And would they be targeted of recovering at least their salary and benefits costs in maximum, in income maximization and savings? Because there's no point in spending. I get the whole thing, spend to save, invest to save, but these people, if you're going to bring people new posts in like that, we've got to have target to say, well, they've got to cover the cost of the actual role. I would have thought. That's one part. The second one was just probably a lack of understanding on my part, again, in Appendix 2 on the reserves. I was talking about, reducing some of these, that £11 million balance, but it looks like we're now out of that 11,091,000, we're taking out the decommitment bit. I understand that, but where's the 8.5 million other bit coming from that's taking us down to 2 million at 31st of March 26? Where's that 8.5 million being spent? Am I missing something?
Yeah. Do you want me to come back on? So, yeah. So
yes, please, Christine.
Yeah. 4.3.6, and scroll back up. The post will probably in the region of 60 to 70,000. I think I'd have to double check what the grading or the banding for it would be, but it's probably that kind of level. At this stage, there's a number of us that are trying to deliver this, but on top of everything else that we are trying to do in terms of our day job. So we're struggling with that capacity to really drive this forward, and it is a whole council system aspect of chargeable services and income recovery. So it's coordinating a number of services and teams and aspects right across all our social care management teams, with for our frontline teams there for chargeable services, but a number of aspects in the background, and with processes and procedures and systems. So we can look at how we build in a target for income recovery into a project manager's job description for that one, and the reserves utilisation that we have. So a number of the reserves that are anticipated to be used this year were our one-off funding for this for 25-26 in terms of some of the system pressures and the money that we'd previously earmarked as our one-off funding for it. And other parts of it is actually just ongoing utilisation and spend against the particular allocation purpose in the first place.
Okay.
So
Okay.
so you know, we've maybe received funding in a sort of previous year, and that's just gradually being eroded as somebody or a team or a service is actually in post. So those figures are built in to our projected position.
So there'll be operational spend this year anyway.
Spend, yeah.
Okay, thanks for clarifying that. Thank you. That's great.
Okay, thank you. And Joe. Oh, sorry, Dorothy, and then Joe.
Thanks, Bob. And thank you, Christine. We spoke earlier about stress and demands on staff, and I must include you and your team, especially over the last few years when money's been incredibly tight and you're doing your best. I've got two questions. 4.3.1. That there are three sections in the table that I don't really understand what they mean: strategic developments, revenue budget support, and service specific. I'm not asking you to explain this now, but perhaps that could be included in the budget development session, you know, just tease out what that actually means.
Yeah, thanks. Noted, Dorothy.
The other question is similar to David's 4.3.6. What occurs to me is that these particular funds, the 500k, were allocated at the end of 22-23 and not utilised. Are there any others in that position? You know, are we allocating funding in 1 year and then 3 years or 4 years later it's still not being utilised? Can someone look at that to see, if there's money sitting there allocated, but for whatever reason is not being utilised? It would just be interesting to know if there are other areas where this applies.
I wish there was. I've looked through as much as we possibly can in terms of the reserves. You may recall back in 22-23, sort of that being right in the midst, obviously towards so we were still in that pandemic and the recovery from the pandemic, and there was quite a significant amount of additional funding that we had presented and put out to the IJBs at that stage across Scotland and quite a few other areas as well. So that in terms of supporting some of the recovery. And 2023, I think we had quite a significant underspend because we got this additional funding, and our spend was just slowly picking up. So at that stage, we did a budget or a reserves policy review and asked the IJB to ring fence and set aside funding for transformation, for other for other sort of investments and opportunities. So ring fencing that into particular pots. So again, that's where our transformation balance came from, was that surplus that we had from a few years ago, and we ring fenced it for transformation and asking services to come forward with proposals, and we ring fenced this particular £500,000 for infrastructure. And it's kind of, it's been sitting there, but we've not necessarily had either a particular purpose or a particular proposal to utilise this. So as part of our review of reserves that we've looked at over recently in terms of what we can look to decommit, and what we can actually look to do some of that investment, and what remains to be legally committed balances for particular purposes that we need to continue to hold for those purposes. This proposal for the infrastructure support funding has evolved, as we've also been recognising we've got a number of pressures, and the proposal to utilise this is hoping to actually unlock some of the next steps to allow us to move some things forward and free up capacity and staff, and make our staff's life a little bit easier as well in terms of some of these proposals. So I wish there was other points.
There's nothing else. There's nothing. Okay.
We will continue to be looking at it, and if opportunities come forward that we may need to go to Scottish Government to actually formally ask them to allow us to change the purpose of some of the things. The only other balance really that we have any potential decision around is the balance of our transformation funding, which we still have, I think, around £700,000 or £800,000 that we have no committed plan for. But obviously if we drop that, if we utilise that this year and drop that now, then we have nothing in terms of freeing up, or that invest to save, freeing up opportunities going forward, and therefore we remain in the same situation with even harder to get out of, but that may come. And I know that our partner bodies will obviously continue to put pressure on us in terms of the underlying risk share, that we look at our own balances and our own position first. So we need to be demonstrating that we are doing everything that we possibly can to address our current year situation and reduce the projected overspend.
Okay. Dorothy, are you complete with your questions?
Yes, thank you.
Thank you. Jim.
Thank you. Just a couple of questions. The one around the kind of recruitment to the project manager for 12 months. Just, has there been any analysis done around, where that sort of person will be recruited from, in the sense of, would it be, because 12 months might seem, basically you're looking at it basically second somebody, and then will there be any knock-on effect on sort of backfill of that? Because otherwise I'm not sure somebody would be moving for something quite a specialist skilled role for just 12 months. So just some work around that. And the other thing is just around the investment into new technology, which I'm definitely not opposed to anything that makes the job easier for people. But just again, just a kind of a word around making sure that we're getting proper due diligence done on that, in the sense of, we've seen far too much in the past across the public sector, sometimes falling for the sales pitch of some of these companies and organisations selling you this stuff, say we can do this, this and this, and that's great, and it sounds great. And then when we actually apply it sometimes, you then actually find, oh, actually we need it to do something else, we need it to do something else to interface with other systems that we've got, and then it actually costs a lot more than was originally planned. So just kind of raising that as a sort of question as well.
Yeah, no,
thanks very much, Jim. Dave, are you going to come in this point as well?
I'll let Christine come in.
Okay.
I'll come
Yeah.
come back there after that.
Thank you.
Yeah, the project business manager is probably still at early stages just now. It's been something that we've sort of recognised we have a gap, but how we actually address that gap and where we get that person from, that will have to be thought about. And because this project is covering a number of aspects from care management and admin support within the council and IT systems, then we will look at how where the best, you know, basically what would we need the person to do and what's the right kind of skill mix for this person. You know, there are a number of individuals that's already on the project team and who might actually be willing to be looking at taking some of this on as well in terms of that seconding out and doing that. But I'm thinking sort of out the box here in terms of how we look at that one. In terms of the technologies, so some aspects for actual purchasing mobile devices. A number of our teams are obviously out and about in the community, but need to return to office bases on a regular basis to access patient or service user files or update and write notes from meetings. And so by giving them laptops or other sort of digital devices that they're out and about, and that is expected to be increasing their efficiency and minimising the sort of downtime of having to return to base on a regular basis. And also the travel cost element is in the travel time there. And some of the actual IT systems and licenses that we are looking at. So some of them we already have the limited number of licenses across the organisations, and a few individuals have managed to access these on sort of short-term basis, and looking for more of our staff, particularly sort of performance staff, performance and data analysis staff, to be looking at some of this increased capacity to help some of the reporting and the data analysis. And we are wary of a potential sort of sales pitch in terms of some of the case management records, and we have been looking at a couple of different options and testing. There has already been some staff testing some of the systems to make sure that we're not falling for a sales pitch, and actually what on the ground these services actually deliver what we need them to deliver. So you're right to raise that, but you know, these will be tested and make sure that we do get the right systems in terms of the value for money for it.
Okay, thank you so much, Christine. And Dave.
No, thanks, Chair. And just going to pick up on a couple of things on the previous conversation there. So, just the kind of 12 months kind of post income generation. Just going back to David's question around, you know, making sure it kind of washes its face, in effect. So I have had kind of a conversation with another area that has done that, and they said it's really kind of, you get a really large return for that investment. So that does kind of give me some confidence around what might be achievable within that. But as Christine says, we'll kind of set that out clearly in terms of expectations and kind of in management and of monitoring of that one. And the other thing I was wanting to come in on was just going back to kind of Ken's kind of initial point around drug and alcohol balances and not kind of looking at that, and kind of just make a suggestion that rather than us kind of going to a vote on this, that we come back with a bit of a kind of detail in terms of the drug and alcohol balance itself. So what does that kind of consist of in terms of the information that Christine's going to put in the report, and then set that against the sort of wider investment that's around drug and alcohol services, and in effect defer that to the December meeting. So rather than kind of put into a vote just now, so we've got a bit more information and a bit more informed before making a decision on that one. But I absolutely understand the kind of points raised on that. Thanks.
Okay, thanks very much indeed. And Ken, I was going to ask you anyway, but I take it the IJV as a whole, are they content with that regarding the drug and alcohol issue?
Well, before I say that I'm content with it, will there still be an opportunity to remove that reduction in the account balance in December? Or is it the case that you'll come back and fully explain it and say there was absolutely nowhere else we can get it from? Because I'd like to think there'll be an opportunity in December. Is it deferred? Is the decision deferred to December? Or are you just going to give me a full explanation, is what I mean?
So, sorry, just to be clear on what I was proposing there, Ken. So, yeah, it would be not make so hopefully agreeing to the other balances, but in terms of the 75,000, we do not agree to that at this meeting. But come back in December with a full explanation of what that is in the context of further drug and alcohol investment. We can have a discussion whether we want to kind of put that down for as a proposal, potentially pick that up in our budget development session next week as well.
I appreciate that, Dave. Thanks.
Okay, thanks. And Dave, presume there'll be a further update on financial recovery at the December meeting anyway. So there may be other items that may arise as well within that context. Okay, thank you so much. With that caveat around drug and alcohol and the explanation given, and that we will not make a decision on that within 4.3.5, can we move to the recommendations that we note items 2.1, 2.2 and 2.3. No, so 2.1, 2.2, and in terms of 2.3, do we approve the financial recovery plan as outlined in the report to address the projected financial overspend position for 25-26, with the caveat around the drug and alcohol decision being removed and deferred to the next meeting?
Yeah.
Yep. And then we go to 2.4. Do we approve the review of reserve balances to decommit 500k from earmarked and ring-fenced balances and utilise this funding to support the 25-26 recovery plan?
Yeah, agreed.
Yes. And then 2.6, we instruct the Chief Officer and Chief Finance Officer to submit this financial recovery plan to the partner bodies as set out in the integration scheme. Yes. Okay. And 2.7 instructs the Chief Finance Officer to provide an update on the financial position and recovery plan progress to the next December IJB meeting. Yes.
Yes.
Thank you. Thank you very much indeed. And I just reflect that here we are 6 months through the budget process so far, and I think it's going to be quite a bumpy ride between now and the end of March. So we may be looking at other recovery methods as well, which will be equally unsavoury. Thank you so much indeed for that. Arlene, can you take us to the next item, please?
Thank you. Yep, that takes us on to item 15, which is the attendance return for meetings held over the year. It's submitted for information. Item 16 is a note of the development sessions, and can I ask you to note as well that Christine's already mentioned there's also the joint development session taking place this Friday at 10 o'clock. And the focus of that will be the mental health model of care and the Tayside GP out of our service reform. And then item 17 is the date of the next meeting, which is the 10th of December. Thank you.
Okay, I have problems for this Friday because I'm chairing something else elsewhere, so I'm pretty sure it's over the same hours on Friday, so I'll have to give my apologies for that. But thank you very much indeed. I noticed that some members had difficulty getting in today. I don't know if they're still here, but so clearly that's been an issue. I don't know what the problem is, but and I'm thinking ahead to the December meeting, Dave, about Wi-Fi connectivity, which is an issue as well, should we reach that position. Okay. Thank you so much indeed for the meeting today, and thank you very much for all of your contributions. And Ken will look forward to seeing you all again on the 12th of December. Thank you so much indeed.